Okay, before we start the slides, we need to kind of go over the upper respiratory system. I've drawn out here the upper respiratory system, which includes the nasal passageways, the nasal sinuses, the nasal pharynx, the oropharynx, which comes back here. Got the epiglottis. So you need to know the sinus cavity. In the sinus cavity too, you have some separating walls here that make it so that when you inhale your air, it kind of comes in and it circulates around these things and through them, and before it goes down to the lungs. That way, the moist and very vascular area will really warm the air as it comes through the sinuses. But right in here, and let's get rid of this because all that it's going to do is get in the way as I try to draw my pictures here. So as you look down here, this here is what we call the nasopharynx. Right? So then in the nasopharynx, you have some things here. You have the adenoids, which are right here. The adenoids, the ADENOIDS, and they also call those the pharyngeal tonsils too. So, and that's right here. And as you can see, if you look down the mouth, you would not see those. They're kind of up in the nasopharynx, which isn't visible as you're doing your assessments and looking in the mouth. And right here in the middle here, you got the adenoids right here. Right here, you've got an opening here, which is the eustachian tube coming from the ears. So right here, that's the opening to eustachian tube. Opening to EUSTACIN tubes. Of course, you got two ears. You've got that coming in from the two different sides. So each side has that. Down in here, you've got your uvula, right? The little thing hanging in the back of your throat. So the uvula, and I'm not going to write that in, but you just kind of remember that that's there. But when we're talking about that, we're down into the oropharynx, right? So nasopharynx. Now here we're talking about oropharynx. When you're doing the oral assessment, this is the only part that you can visualize. And in the oropharynx, we have right on the sides here, we got the uvula in the middle. Then right on the sides, we've got I guess I'll just kind of go in that area. Come down here, and we'll say palatine, P-A-L-A-T-I-N-E. Palatine tonsils, which people just call them the tonsils. Right? So when you're up here, the adenoids, a lot of people call those the pharyngeal tonsils, but down here, the palatine tonsils, those are the ones that we think of. So I like to just say the adenoids so it doesn't confuse people, and then the palatine tonsils, we just call those the tonsils. Because that's how people refer to them. So I'm just going to take a real quick look and real quick thought about how things would look if you get infections or inflammation in the area. It's going to get a couple real quick ones out. One thing I'm going to talk about is the eustachian tube opening right here. Difference in kids versus adults. When you get kids is more straight and wider. So you get kind of, I'm going to go ahead and draw the opening here, right, in the nasal pharynx, and this is a child's, and that opening comes over like this. Then you've got the inner ear part stuff here, and not accurate at all, but then you got the tympanic membrane. In this inner ear here, you've got a straight, the eustachian tube is kind of a straight tube there. Going straight over to the inner ear, and that way what it does, it can equalize the pressure in the inner ear, because this here is airtight. So with this being sealed, the only way that you can equalize pressure is through the eustachian tube. So it's an important opening. But on children, this is how it looks. Now on an adult, right, so we're right here still, and the adult has grown, and through the growing, the tube has kind of come, you've got your eustachian, your tympanic membrane is what that's supposed to be. So you end up with the tympanic membrane. I should draw the little bones in there. There's 3 little bones, the hammer, anvil, and malleus, which are the smallest bones in the body, by the way. As you can see here, the adult versus the child, quite a difference, as the growing has made quite a difference here. This here has really come and stretched it out and made it thinner, and it's got a couple of curves in there now as the person grew. So as you get an infection here and you get some pus growing in here, it comes and it kind of stops there. So it might get blocked off and you get plugged ears, but the infection doesn't usually get all the way back over to the ear. But here, when you get an infection here, the pus just has a real easy way of getting back in here, and you end up with middle ear infections. That's why children have a lot more ear infections. Adults get these same pharyngitises and infections in the throat, but it usually stays there and plugs up the ears. Whereas this here goes into the ear, and you get the infection within the ear itself. So the ear builds up the pressure, and it's really tough. You can give the medicines are real quick to get rid of the infection here, but not here, and you end up with the bulging tympanic membrane, because like I said, that's sealed. So you get that increased pressure, the bulging tympanic membrane, and sometimes it even ruptures and pops. When it ruptures and pops, the pain goes away because you've gotten rid of all that pressure. That's why with children, a lot of times they come and they put a tube in here, just a little teeny opening. It creates a little opening in here. That way when they get these infections, and some children have even a bigger pathway there, so they're going to be really prone to having infections. So when that happens, they'll put that little tube in there so that when the pus and stuff builds up, it can come out through the tube without it rupturing the tympanic membrane. Because every time when the tympanic membrane ruptures, it will heal up and they will get their hearing back, but every time it happens you lose a little bit of that hearing. And if you end up with just a really super scarred up tympanic membrane from rupturing and healing and rupturing and healing and rupturing and healing, you end up with really a lot of loss of hearing because of that. So the tubes can save that. So that's one of the things that you end up doing. So the adult, a lot less likely to have, not that it doesn't happen, but you all know that as adults we don't get earaches like we used to when we were kids. And while most of us have a memory of the earaches that we had as children, we remember how severe it hurts. I mean, it's really a very severe, painful thing to go through. So that's this right here that I was talking about, right? The eustachian tube. And now think about it. When you get an infection, one of the things that you can get here is infection or the adenoids, right? You can get a nasopharyngeal infection, which happens down here in the pharynx of the nasopharynx, and you can get adenoiditis. So when the adenoids get swollen, it's not something that you visualize on inspection when you look down in the throat. Right, the adenoids get swollen back in here. But what will happen? This guy gets really swollen up. It blocks off the nasopharynx, right? So you can't breathe through your nose. Right? You're really terrible, and all of this buildup here in the sinuses, it can't drain down the throat like it normally would want to. So you get up with runny noses and just a really bad stuffy head. A lot worse than just having rhinosinusitis, where you might get the inflammation right up here, because it's way back here, and everything in this area is unable to drain. You've got a stuffy nose, and just quite frankly, you just feel really miserable. Another thing that happens with adenoiditis, it's right here by the eustachian tube. So the swelling that happens right here, we usually block off the tube. So when you're over here looking at the tube, it blocks off the tube. right? So you aren't able to equalize that pressure in your inner ear, so you end up with plugged up feeling ears. That's adenoiditis. So I'll just put one here, adenoiditis. So the symptoms are stuffed up, stuffy nose, blocked eustachian tubes, so plugged up ears, and of course the signs of infection, which is fever, chills, body aches, chills swallowed by sweating, stuffed nose, stuffy nose, and plugged ears. Might be a normal looking throat, right? You don't necessarily see it in the throat. Normal throat on visual inspection. Put a question mark there because you might see the redness. You get the inflammation stuff here, the redness is going to spread around. So when you look down in the throat, you're looking back in here. You might see some redness back in there. But it isn't going to look as bad. For as bad as the person feels, it doesn't look quite as bad when you look in the throat. Now let's talk about the next one here that can happen. So now what I want to talk about here is the oropharynx. Oro, P-H-A-R-Y-N-X. And like I said, this is the only part that's visible during your assessment when you're looking in the mouth. It's the only part that's visible there. So let's say that you get tonsillitis. You can see those tonsils when you look back in there, right? They're right in here. It's on this lateral view like that. It's kind of hard to draw it, but come like this. Right, looking right down in the mouth. There's the tongue. You come like this, and you got your uvula here. Right, so that's what you should be seeing. Well, now if they have tonsillitis, the tonsils are the palatine tonsils, right? That's what people call the tonsils. And you do have the adenoid tonsils too, but the adenoids are, but we're just the palatine tonsils, right? So that's what we call the tonsils. They're right here. They get swollen. Instead of this coming down nice like that, you're going to see, I'm just going to draw the tonsil on one side. You don't usually see it on one side. It's going to be like that, right? So with tonsillitis, you're going to see swelling. And you're going to see redness. And you might see exudate. That just means white pus patches. You're going to see on oropharynx, you're going to see in the oropharynx, you have your tonsils. So when you have tonsillitis, you'll see swelling of the tonsils like I was drawing right here. Redness, exudate, white pus patches. Have pain, sore throat, right? So you got pain, and you get fever, chills, body aches, and another big one here is this pharyngitis, right? A lot of times you go to the doctor says you got pharyngitis. Pharyngitis, right? So what the heck does that mean? Well, that means is the pharynx back in here is red and swollen, but the tonsils aren't, right? And I shouldn't say swollen, red, right? And there probably it might be some edema there, but it's not as noticeable as it is with tonsils. Look down in here in his throat, and boy, it looks red back in there, right? You look there, so wow, it's really red, but you don't see the tonsils aren't all swollen. So you just see the redness in there. So then they have pharyngitis, you can figure, right? And they have all the signs of infection. And one thing about this here when you get pharyngitis is, I didn't say cough so much with these. I'm not saying you can't. Sometimes you get that drip and it kind of goes down there and makes you cough. But with pharyngitis, you actually will get a cough because you're getting inflammation in the pharynx. And this here, the epiglottis here, as you can see, is right here. This here is the trachea, right? And behind it is the esophagus. And that's the epiglottis, the little flap of skin that folds over the trachea when you swallow so your food doesn't go down into the trachea and consequently into your lungs. So this guy here can get swollen, right? So and it gets irritated, and you get a lot of inflammation and exudate right there on that. So this here is constantly being irritated. When the epiglottis is irritated, it makes you cough. Plus, if you're getting that right here, you don't want the pathogen that's growing on the walls of the pharynx, of the oral pharynx, to be dripping down into the trachea, because then you end up with the infection in your lungs and you end up with pneumonia. So it's a defense mechanism. You're just constantly going coughing to expel whatever is right in here, and it's being triggered by the inflammation there on the epiglottis. So that is the upper airway.